It's March 24, 2021. Today's episode number 171. The vaccines work. Real life data. It's a 39.6 Facebook and YouTube live finance show. The show that teaches high earners like yourselves how to make your money work for you so you don't have to work for your money. We talk general investing, taxes, real estate, syndications, Airbnb, paying for college, paying for childcare, and even the car you drive. Today, another special health episode on the vaccine because there's nothing more financially important than your health and the health of the people around you. Today may be one of the most optimistic days I've had regarding COVID since the day I got the vaccine. This is just groundbreakingly awesome stuff. New England Journal dropped 3 short, I think they were all letters to the editor. One from UT Southwestern in Dallas, one from University of California, San Diego / UCLA, and another from Hadassah Hospital, the awesome hospital in Israel. All showing their real life hospital data after they started their massive rollouts of the vaccine. So here in Dallas, I was very privileged to having had the opportunity to get vaccinated at Parkland on December 17th. And the UT system got a huge bolus of vaccines delivered on the 15th, and they got started right away, got their highest risk healthcare workers, and then very rapidly opened it up to other healthcare workers. And they just had an awesome system going very quickly. They were vaccinating, I don't know how many per day, probably 1,000 plus per day. And pretty much right off the bat. And they had it at Parkland, at UT, and a number of campuses. Okay, but they had a very good supply right over there at the very beginning with Pfizer. And at the beginning, a lot of people jumped at it, and a lot of healthcare workers had vaccine hesitancy, even healthcare workers. And that, when I found that out so quickly, that about basically half of healthcare workers were not getting the vaccine, I was like, oh my gosh, we are never going to find the end to this. Because if we can't even get half of healthcare workers to get vaccinated, we have no hope in the community. But this is awesome stuff. And this is the key, I think, to really having safe openings of businesses all over the country. I know in Detroit, they actually just announced that people who work and out of their house, see people, either they're eligible right now or they're going to be within the next week or so, because we need people to be safe from A, getting it, but also B, transferring it to other people when they're working, right? That's how we can really help mitigate the spread. So with these massive rollouts in the hospitals, these institutions just published their data as to what happened. So at UT Southwestern, they had 23,000 employees that they have, and they looked at during the first 31 days. So from December 15th until 31 days after that, they had 23,000 employees who had received a first dose of one of the 2 vaccines. Okay, 59% of the employees got it, the first one, and 30% received a second dose. Okay, and they followed them for a period of time. Now, the data here is just awesome. So of these 23,000 people, okay, again, about 60% of them had gotten a vaccine, 1 or 2. Okay, so partially vaccinated is in the middle. These people had 1 vaccine, or they had their second vaccine, but less than 2 weeks out from it. Okay, if it was the Moderna, or 7 days out from it if it was Pfizer. Then the last column here are people who were fully vaccinated. So the full amount of time after they got the second vaccine, 8,000 people. So 8,000 people were fully vaccinated, 8,121. And of those people, only 4 people tested positive for COVID in the amount of time they were following them up. Okay. only 4. That's 1 out of 2,000 people. That's 0.05%. The vaccine is just unbelievably efficacious after you get the second vaccine and go through that wait out period afterward. And then in the near term future, it's unbelievably effective. If after you go out months, it can wane, but in the short term period, it's unbelievable. The people who did not get vaccinated, which was about 40% of them, they had about 50 times higher rate of getting a positive new COVID, tested positive for COVID as a new person. Okay, so these are the employees of the 23,000 person system, and if you own a business or manage people in these businesses, if you get exposed or are positive, you have to quarantine, and this is very challenging because you have to pull your healthcare workers out of the hospital for a certain period of time, and now you lose people, and it makes it harder to keep your staff up when your hospitals are overloaded. So this is like a huge, huge, huge deal. So they have the second plot here, which is really cool because you can really see what happened over time, okay, as the rollout occurred. So I'm going to turn off my little icon if I can. Let's see. I'm sorry, I want to turn off my title, my caption. Okay, hide. There we go. Okay, so this second graph is actually even cooler because what they graphed here is the number of positive cases they have per day on every single day dating from October 1st all the way until the end of February. Okay, so each dot represents a day. So like on the weekends, it's like 0, or like on the holidays, it was like 0. But then you can see it kind of bouncing around. The beginning of October was like 1, 4, 4, 1, or 2, 1, 3, 3 per day. So like less than 5 per day, the beginning of October. Then there were days when it was between 5 and 10. That was until the end of October. But then we get to November, then it starts climbing and it gets higher and higher. And then by mid-November, here we have a day of 13 positive tests. So the trajectory is going up higher and higher. And then on December 15th here is the red line. That's the first day they started vaccinating people. Now, you don't see a change in the number of positive tests right away because immunity doesn't happen immediately. But they were vaccinating a lot of people from December 15th, 16th, 17th. Once you get into, so they go through a 21-day period here, or a 28-day period. Okay, 16 plus 9, yeah. So they go through basically that period here, the blue line, which is like the first period of time when these people are getting vaccinated and getting their second vaccine and become fully vaccinated. Okay, so they get Pfizer and then they wait. And here you get basically people who are fully vaccinated. And look what happens in the second week of January. The numbers just plummet down very quickly. Okay, so this was when the numbers were the worst. Okay, remember around Christmas time, everybody got together, and then the 3 weeks later, it was peaking all over the country. And within the hospital, the employees, 3 weeks after Christmas, we are down here with levels of like numbers of 1 positive test per day. Okay, and then it didn't go above 5 positive tests per day starting the second week of January. And then once you get into February, you get down to February 12th or 13th, they had like a whole week of 0 positive cases. And then it was like 1 per day after that. So it just drastically went down so quickly. Now, when they reported their numbers, by February 5th, they had about 70% of the people, of their employees were vaccinated. And they had gotten it up to 78% by March 5th. Okay, 70% on February 4 and 78% by March 5th. That's a good percentage. over the course of 2.5 months. They got up to 78%. I'm sure it's higher now. March 5th was like 3 weeks ago. They're probably over 80% now. So they've basically gotten to the point where they have basically herd immunity within the hospital. And they even shut down one of the ICU COVID units yesterday. I believe I saw in a separate article. So that's awesome. I mean, if you get 80% of your people vaccinated in your building, they're not spreading it to each other. They're not getting sick, and they're not spreading it. At least it doesn't look like they're spreading it. Certainly they could still get it from patients, but they're obviously protected because the numbers went down so much. But look at this. The count of total employees in self-isolation or quarantine. Now this is awesome. Like when you look at it from the business perspective. Okay, so self-isolation was a 10-day isolation period starting from the first positive test. Starting here in December 14th, okay, it was over here on 250 employees. 2 weeks before that, it was around 325 employees. And right after the new year, it got up to 350 employees were all out on self-isolation or self-quarantine, probably because they had an exposure over the holidays, Christmas and New Year's. But remember, the vaccine came out here around December 15th. It takes a couple weeks for it to have efficacy and more people to get vaccinated. And then boom, straight down. And then by the time you get to February 21, you're down to like 20 people who are self-isolated or in quarantine. And at this point, you have 70% plus of your people immunized. So the vaccine works. I mean, this is just unbelievable. And it wasn't just here. Okay, so then they have the UCSD, UCLA data. And they broke it down a little bit differently. They reported the number of cases, new cases, at different time points after dose 1 or dose 2 of their 2 different vaccines. Sorry, I'm going off the screen here. I'm going to try to adjust that for you. Although it does not really want me to. I apologize. Okay. All right, but I'll just basically show you this last line, which is the most important. Okay, now it's showing up properly. So the people day 15 or later after the second dose, there were 15,000 people who had already received the second dose and 15 days later were available as to be included in the study because they had gotten the vaccine early enough. And you find these, and you follow those people until the last time they followed people, all the way through February 9. Only 7 people had gotten a new infection, okay, out of 15,000. So we had just said 4 people out of 8,000, and here now we have 7 people out of 15,000. It's the exact same. It's 1 per 2,000 people. It's 99.5%. Or 0.05% of people got it. So amazing across 2 different studies with 8,000 in one group and then 15,000 in this group across Texas and then California, where they have different strains. Okay, but they have the exact same vaccines. Okay, they had the same Pfizer and Moderna vaccines. The strains were probably more similar back then, but certainly there's been divergence now. But they showed the same thing. And it's just remarkable to see this happen in action. I had seen people report this in Facebook groups of saying how much infections have gone down, but to see really numbers to this level is just awesome. So with healthcare workers now, at least at UT, they were up around 80%, probably higher. That is a lot more reassuring that now that we've had some time pass since these have come out, that at least now we're getting healthcare workers. Okay, we can't expect the public to get vaccinated if we can't get healthcare workers vaccinated. So healthcare workers, we really need to be an example to other people and get our own places, our own hospital, our own clinics vaccinated. I got an email from Baylor Scott and White Hospital System. Their goal is to get 100% of employees vaccinated and really pushing to get 100%. If we get 100% of all healthcare workers, then that'll go a long way to minimize spread amongst staff, from patient to staff, staff to other patients, etc., and really helping improve herd immunity, at least within an individual place. Like, we would love to have herd immunity everywhere, but if you can get it like in your household, right? If there's somebody in your household you can't get vaccinated, but if you can get everybody else vaccinated, you protect that one. If you get all the employees in the hospital vaccinated, you help everybody in that hospital. You help all the other patients in that hospital. So you don't have people transferring it patient to staff, staff to patient. That's one of my biggest fears, because we don't test staff, right? And we have like transport people who literally go bring one patient from one part of the hospital to another part of the hospital. Then they go to another person and then move that patient from one part of the hospital to another part. And you have teams of people doing this, and they're not getting tested like on a daily basis. And they're just going back and forth from place to place, often in groups. And then it also transfer people to other hospitals, and substantially significant risk of spread if they are not vaccinated and not meeting all the precautions. But having that vaccination provides that very strong layer of protection. I mean, 99.5% of people fully vaccinated did not get infected within this period of time. So just incredible. So that is it. This is how we're going to get businesses back open safely. This is how America can reopen. This is how we can protect the people who aren't vaccinated. The numbers are just incredible. Now, it's basically a race right now between now and the new variants. I hope we don't have a huge spike with spring break the past 2 weeks. I really hope, with states opening up vaccinations the next 3 weeks, if we can really increase that percentage that's vaccinated, hopefully we can get a good percentage and mitigate those other variants, which are much more infectious and with higher risks. In Texas, we're at about 22%, I think, who've had at least one shot. And those numbers can go up very fast with the amount of vaccine we're getting. But hopefully we get vaccinated fast enough before the new variants start to take potential to another spike. All right, that's it for today. Thanks for listening for episode number 171. The most important thing you can ever do for yourself financially is take care of your health and those of others, and the health of those people around you. Okay, something like that. You take care of your own health and people around you. Absolutely. All right. Until the next episode, 172. Thank you, everybody, for joining the Facebook group. Invite your friends. We're up at over 1,000 members. Ask your questions over there, and I will answer them when I can. Have a great night.